Hi there, this is Dr. John from the Florida Center for Hormones and Wellness, and I want to thank you for joining me on my video blog today. I want to talk about a very interesting and a very pressing topic that is so important that they've even dedicated a month to it. That's the topic of breast cancer. As you all may know, October is Breast Cancer Awareness Month. During that month, we focus a lot of time and attention on early detection and treatment of breast cancer. We have rallies, we have events, we have special deals on mammograms, and we do all kinds of things to heighten the awareness of breast cancer and to bring it to people's forefront in their mind so that they can understand how crucial this diagnosis is and take the steps to make sure that they're identifying it and treating it early. But I have to ask a really big question. We sit there and we spend all of this time and effort on treating breast cancer. Why do we not focus in on some of the things that may actually be available to prevent breast cancer? Prevent breast cancer, you say? You're a hormone doctor. I thought hormones cause breast cancer. Well, that's partially true, but it's really not true for the type of hormone therapy that we do. You see, back in 2002, a big study was produced in on women's health in the Journal of the American Medical Association, and that study was called the Women's Health Initiative. And in the Women's Health Initiative, they found that using a synthetic progesterone or a progestogen called medroxyprogesterone acetate, which is basically a toxic chemical, along with a very powerful estrogen that's not found in women, but it's found in horses, or called Premarin or pregnant mare's urine. When they combined these two chemicals, they actually did work together to some degree promote breast cancer in women. That was borne out not only by the Women's Health Initiative, which by the way is very misunderstood and misinterpreted by so many people, but it was also found out that when women take this combination of chemicals that there may be an increase in the risk of breast cancer. And I'm not here to argue that or to say anything about that. But what I am here to say is that evidence has been conflated with what happens with biologically identical hormones, or human identical hormones, as I'm now starting to like to call them. What those are hormones that are taken and they look chemically identical to the ones that are in women today. And when we see this, we look and we study those hormones over the course of time, and we find that as those hormones decline, the rate of breast cancer increases in women. So we've been told that hormones cause cancer, yet the literature clearly states when those hormone levels decline in women, the breast cancer rates go up. How can that possibly be? When the natural hormones decline, breast cancer rates go up. So how can it be that just maintaining hormone levels of the natural type in women, how can that be harmful? Logic clearly tells you that that's not true. Excuse me. And what we find is when we look at the literature and we look at the studies that are out there, when we use biologically identical hormones, such as the ones that we use at the Florida Center for Hormones and Wellness, when we use those biologically identical hormones and you look at the literature, the rates of breast cancer actually stay the same or in many cases decline. Now, you'll never hear that very much about hormones from a lot of traditional doctors and conventional wisdom, because we all know from what they tell us that hormones cause cancer. And yes, synthetic, artificial, horse hormones cause cancer, but not the biologically identical ones that we use every day in good hormone practices that understand women's health. More than that. So when we keep women hormone balanced, excuse me, we can keep them from getting cancer. At least we will not see cancer rates raise according to some studies, and we may see cancer rates fall according to others. But it gets better than that. When we look at two specific biologically identical hormones that we use every day, one progesterone and one testosterone, we see something quite remarkable. There have been several studies recently that have been done that looked at specifically progesterone. Progesterone, another biologically identical, human identical hormone that we use. When we use that in women, progesterone has the effect of stabilizing breast tissue. And what does that mean? It means that women who have higher than expected progesterone levels for their age, such as what we can achieve when we give that back, we can actually suppress the development of breast cancer and in many instances reduce that risk. Wow, that's an important statement to know and understand. More than that, there's some amazing work going on with the use of testosterone in women. Testosterone is kind of the fun hormone. That's the one that makes us feel good. That's the one that makes us think straight. That's the one that gives us lots of energy, and beyond that, that's the one that makes intimacy so much fun and so much better. It promotes sex drive and sexual wellness. Well, we look at a very important study done out of Dayton, Ohio by Dr. Rebecca Glazer. What we find is that when we use testosterone in women that actually have breast cancer, active breast cancer that she's treating with surgery, when she gives them breast cancer, the rates of recurrence drop dramatically over those who do not use testosterone in the immediate postoperative period. Beyond that, what she's found is that when you use testosterone in women who do not have breast cancer, you can reduce the rate of breast cancer occurrence by almost 70%. Did you know that there's a substance out there that's available on the market today that's very low cost, it's very easily obtainable, and it can be administered and actually make you feel better? Yes, it's testosterone. It reduces the rate of breast cancer, and these results have been independently confirmed by the University of Adelaide in Australia. So, in summary, what I want to tell you is that Breast Cancer Awareness Month is a very important month to be aware of breast cancer, to do the things that we need to do for early detection and early treatment. But beyond that, I want to suggest we should be doing more as a medical community. We should be promoting things that may very well reduce the risks of breast cancer. And in this little short video, I alerted you and brought to your attention 2 biologically identical hormones that are very common, very easy to get, and very easy to use in the right hands with a doctor that knows what they're doing to help reduce the rate of breast cancer. That would be progesterone and testosterone. And I'm Dr. John Carrozzella from the Florida Center for Hormones and Wellness, and I would like to thank you for taking your time to watch this video. And if you have any questions, please feel free to contact us at our office by phone or by email.